My name is Shaukat Ali and I'm one of the councillor in Cheetham. Today we gather under the banner of Tackling Health Inequality Project with the primary objectives are supporting the Manchester Cheetham Hill Crumpsall neighbourhood, especially focusing on the South Asian community. Mission as a local councillor to the project is very clear: to provide meaningful and tailored information, trainings and guidance to bridge the health gap through the establishment of network. Mental health, cancer, cardiovascular diseases and diabetes, which the project will focus upon.
The aim of today's seminar, as I mentioned, is to launch a project within our South Asian community that tackles health inequalities, and also to bring together individuals and groups that can explore the best way to tackle health inequalities that they have identified within our communities. And our main focus is going to be around diabetes, mental health, cardiovascular diseases, and also cancer, which is on the rise within our communities. And I suppose off today's seminar, we're hoping to formally establish a Tackling Health Inequalities network, which will be meeting on a quarterly basis.
My name is Lizzie Hughes. I'm really pleased to be here, so thank you so much to the people that have coordinated and organised this event. I work for Manchester Local Care Organisation, and I'm the neighbourhood lead, the integrated neighbourhood lead for Cheetham and Crumpsall. So I'm going to explain a bit about what my role is first, and then I've been asked to do a bit of context setting. So I'm going to talk a bit about Cheetham and Crumpsall and some of the things that we know in terms of the facts, the opportunities and the challenges for our neighbourhood. So I guess the questions that I'm really interested in this project looking at is, what is it we can do to support people to manage their own health better? What is it that we can do to support people from our kind of South Asian communities to put in place some of the things that support their health outcomes at an earlier stage, so people don't present later when their health conditions are poorer and they need levels of medication to manage.
Thank you so much for inviting us to come and talk to you today. We're just going to do a really brief overview of health inequalities in the city and just a snippet of some of the key projects that we're doing across the City Council with our partners to tackle health inequalities. Just very quickly, my name's Anissa. I am the programme lead for Community Health Equity Manchester. I'll talk to you about that in a bit more detail from the Department of Public Health, Manchester City Council, and I'm here with my colleague
Saima Anwar. I'm the Programme Lead for Health Equity, and I also work in the Public Health Department, and I'll be talking about some of the projects that I'm working on within the Public Health Department.
Thanks, Simon. So we're going to do a bit of a double act. I'll start with the first part of the presentation, and then I'll hand it over to Simon.
The Umeed project, and that was based from our national strategy to help improve equity of access to genomic services, but to also enable families to make informed reproductive decisions. So what we've set up in Manchester is the volunteer peer support programme called Umeed, and that has an aim to promote a healthy pregnancy and improve outcomes for women in pregnancy.
Mental health issue has a massive impact on our BME communities, and that's leading to homelessness issues and to isolation and stuff. So it's important that resources are brought into this, whether it is diabetes, whether it is mental health issues, because it's having a massive impact in our communities. And like the young man said, it's fine bringing in vaccines and stuff, they have other impacts as well. They have other, issues with it as well. So it's important that, the communities are thought about in the long term, as most of the speakers have mentioned in this seminar today.
So I think that lack of courage is there as well, which is the cause of loads of these health issues, and we are not able to describe ourselves, and we think that trust factor is there as well. But lack of courage from our side and acceptance and openness from all the professionals is the main thing as well, which we discussed as well, along with other issues.
I'm just going to talk about how I found the event today, and we've had at least maybe about 50 or 60 people from across the community. I thought that the speakers all were really insightful in terms of talking about the things that they were really aware of in terms of health equity, from a primary care perspective, from a council population health perspective, but I think probably the most interesting bit for me was hearing from our community about the things that they found in their experience of accessing healthcare and some of their frustrations and the need for us to do better, I think, in terms of how we're meeting community need. Some of that touched on funding, some of that touched on how we are accessing some of the people in our community, like women that might not get out very much, and some of it talked about the fact that actually we know some of these health conditions or issues in the South Asian community, and it's probably incumbent on people like me to do something about it. But hearing that from the community has been really powerful. I've also made some good connections, so I'm looking forward to picking up some of my conversations outside of this meeting. So this was the launch event. I think it's been a really brilliant opportunity and a great starting point.
Okay, my name's Hanfi.
And my name's Kizza.
So we attended this event because we wanted to learn more about health issues within the Cheetham Hill Crumpsall area, and found it really useful. Big audience here, some really top speakers from the council, from public health, and across this area with support from local politicians.
Absolutely, and I think really importantly as well, we heard from the people on the ground. There was a really diverse audience, probably about 60 or 70 people in the room, and it's fantastic to see that engagement at a grassroots level, and for those very, very important voices to be voicing their concerns to the people in charge with influence. So fantastic day, great to see everybody, and we hope to see everybody again very soon.
Yeah.
Look, it's wonderful to see that communities coming and attending the health inequality in North Manchester. This is the first time we're doing it, and the officer did a good presentation where they're making awareness to the diseases in the BME community, which is very important to highlight, and making awareness and running program and interacting, asking them what they want, how the officers should be tackling this